Hello and welcome everybody to our panel on digital campaigning for family planning in the age of AI. So today we're going to touch upon a subject that is very close to my heart. My name is Ariana de Hoog. I work at the Bayer Sustainability team. We're going to touch upon a unique way to help girls and women, specifically in low and middle income countries, using digital tools and AI in family planning. Now, I had the privilege to be part of the gender equality discussion yesterday, to watch that. It was fantastic. And some women said it's not just about sexual and reproductive health rights when you talk about women's rights. Absolutely true, but it is a good place to start. So the discussion that we will have today is linked to two of the Sustainable Development Goals. The first one is SDG 3, good health and well-being, and the other one is SDG 5, which is gender equality. And of course, one goes hand in hand with the other. And the other fact that is so fascinating when you talk about family planning and the rights of girls and women is, according to the Copenhagen Consensus, every dollar spent on family planning reaps $120 in economic benefits. Yet, in low and middle income countries, over 218 million women who want to avoid pregnancy are still not using safe and effective family planning methods. And the reasons, we know many of them. They include lack of access to the information and the services that they need, the fear of the side effects, cultural norms, or lack of support from their partners or communities, just to name a few. And these factors threaten their ability to build a better future for themselves, their children, their families, and their entire communities. And it also affects our growing world population. And this is where the use of digital technologies to help support healthy and sexual, reproductive, and sexual behaviors is one of the several promising practices when it comes to family planning. And when we talk about digital, what are we talking about exactly here? So digital includes the mobile internet, so via phones, tablets, and other devices, and these have become more accessible than ever before. In recent years, it's become clearly apparent that digital technologies can improve health outcomes, and especially young people are becoming more digitally savvy than ever. Digital technologies enable us also to put accurate information at young people's fingertips, empowering them to make healthy and informed decisions. Advancements in digital technology have opened up entirely new ways of reaching people, but of course, this does not include everyone. Many rural and vulnerable communities still struggle to have this access, and we also have learned that the best combination is to provide digital tools with the face-to-face community support. But it is undeniable that digital options are opening doors, and AI may provide entirely new opportunities. According to the experts in this field, there are key requirements in the success of digital tools in family planning, and these include, of course, the rate of internet penetration, so the digital ecosystem of a country, involving young people in the development of these tools or adjusting to the user needs, the accuracy of the information that's provided, and of course, creating a no-judgment space for young people, bridging this digital divide and reaching a much larger group of women. So together, we need to continue to adapt and employ these emerging technologies and tools to improve access to family planning and reproductive health information and services to people across the globe. And as family planning goes hand in hand with gender equality, the future of the one will impact the future of the other. We have an extremely esteemed panel here with us today, the true experts who will give us further insights into amazing projects that are already happening, opportunities, challenges, and other wonderful partnerships that are going on in the world of digital and AI when it comes to family planning. So I would very much like to welcome Negina Mutian. She's Innovation Unit Chief, UNFPA from the US. We have Klaus Runge, Head of Market Access, Public Affairs and Sustainability from Bayer here in Germany. We have Ikechukwu Anoke, Founder and CEO of Zuri Health, Kenya. We've got Javier Francisco Gonzalez Bello, head of the German Red Cross delegation for Colombia and Venezuela from Colombia. And we have Nomi Fuchs Montgomery, family planning deputy director from the Bill and Melinda Gates Foundation, USA. Welcome, and thank you so much for joining us here today. So turning to all of you, I'd like to give each of you 5 minutes just for a brief introduction of yourselves, your organizations, and to answer the question, what projects is your organization currently involved in when it comes to those digital activities for girls and women? And maybe we'll start with you, Nagina.
Thank you. So, as you kindly presented me, my name is Nigina Muntean. I am a doctor, I'm obstetrician gynecologist by training. At the moment, I lead innovation at the United Nations Population Fund, which we now call United Nations Agency for Sexual and Reproductive Health. And of course, family planning is at the core of what we do. So we have 3, as we call them, transformational goals which we want to achieve, is to end all unmet needs for family planning. It's really fundamental for women's bodily autonomy and her decision power, to end all preventable maternal deaths, and also to end all forms of gender-based violence, which include harmful practices. So what I do lead? I lead Innovation Accelerator Fund, which we call Equalizer. We really believe that with innovation and technology, we can equalize opportunities for women and girls. It's really all about opportunities. And our Equalizer has 2 pillars. One, we invest in the startups, in female-led social enterprises to enable them to create solutions addressing women's health needs. And we also just launched yesterday, and Bayer was there because Bayer was one of the first partner and champion of that, and Klaus is our champion, Equity 2030 Alliance, which is aiming to close gender equity gaps in data sets, in solutions of the technology, science, and financing in women's health. Of course, digital for us becoming more and more important, digital solutions. But just to clarify, and I think that's not a news to any of you, digital tools are not the end goal. Digital tools are enablers. And we always start, okay, what is it we want to address? What problem we want to solve and where? What's the context for it? And then we think, can digital help? And oftentimes it does. But that's the mean to achieve it rather than an end goal. Oh, let's just put some digital solution there. And I think that's how many works. Those who work for the impact rather than for either profit or just to be cool, yes, we use AI. This is the only way to make it really impactful. And of course, latest development, especially of AI and technology, forced us even to use it and apply it more. And just a few examples. In India, we just started with the generous support of Bayer, Just Ask solution. And it's a platform, digital platform, which also uses AI-enabled chatbot. But it's more than just chatbot. It uses the comprehensive integration of the healthcare system around, referrals, enabling of the health force around, and availability of the contraceptives and other commodities to really enable young people to get access to information, reliable information, ask questions in privacy, not being judged, trusted, but also know what's happening around you, and enable the health ecosystem around to support that. You know, population in India is pretty sizable, so once the project takes off, we really hope it will reach and help quite a number of, especially young people. Another project, also pilot, is happening in India, is the other side of training. So we train midwives through the Safe Delivery app, which also has family planning component. And we also prototype, by the way, was also supported by Bayer, and then our first pilot is supported by another company, Organon, and we do it in collaboration with the Maternal Foundation. So we train midwives, healthcare workers, to give them information within the controlled data set, which I think is the most important here. It's not just anywhere from the web. It's controlled, quality assured information, which also gives us the backdoor analytics. What's happening? What questions they ask? Where is the gaps in their knowledge and skills? So we can address it through offline training too. Another examples of technologies we use, we just introducing it in Honduras, is the AI-powered ultrasound. And this is really developed for the low skills settings where the community healthcare workers who are not trained at all on how to use or read ultrasound results. So the solution Baby Checker can help them to identify gross abnormalities because it's guided by the AI. And I know Gates Foundation also introducing similar solution. This is really where high tech helps low tech, because then you can refer in time when you see the risks. We also in Colombia introduced the solution Partero Vital, where we train traditional birth attendants. And they are connected with conventional midwives, get training, but also they can now register those births, because before these children didn't exist. They were born, but there was no system to register them. So now, obviously, with the registration comes all the healthcare access, education access, vaccination, everything they need to really survive and thrive from the start. So these are just few examples. And of course, we're still learning and experimenting, I would say. I wouldn't say we already can give you a lot of results. COVID pandemic obviously forced us even to innovate more using technology, because when we found people locked down with limited mobility, we needed to introduce how we can still continue training, how we still can continue access to information, medical services, and diagnostics. And I think it's really exciting to see how it's developing, and also exciting to see how it's developing in partnership between public and private sector, because technology innovation comes from private sector. Yes, the normative side of it comes from public sector, ethical side of it, the principles, but the development of that's where the private sector plays a really critical and crucial role, and that's why this partnership is really important. Thank you.
Thank you. Klaus.
Yeah, thank you, Nigina. Thank you, Ariane, for opening the session today, and welcome everyone to this panel, also for those of you who have dialed in online. My name is Klaus Runge. I'm the Global Head of Market Access, Public Affairs and Sustainability for the Pharmaceuticals Division of Bayer, headquartered here in Berlin, where this year's World Health Summit is taking place again. Delighted to talk about digital campaigning for family planning in the age of AI. But before I go into this, I would like to stress that probably SDG 5, which is achieving gender equality and empowerment of all girls and women worldwide, is probably one of the key SDGs to really enable us to meet a broad array of the other SDGs. So I think without gender equality, we will be in a difficult spot to reach many of the SDGs that have been spelled out. And when we as a company sat down and defined our sustainability agenda and strategy for the years to come, of course we thought about decarbonization, which is key in many regards, and some of the sessions also describe here the intersection between climate change and health, which, by the way, also affects women oftentimes overproportionately. But we also looked into the S component, the social component of ESG, and we figured out where we would have the biggest impact as a corporation with a global footprint. So, and we said, as a leader in women's health, that's where we want to have a big contribution. And in 2019, I was attending the ICBD 25 conference in Nairobi, and made the public commitment that Bayer would help 100 million women in low and middle income countries gain access to modern contraception. 700 million women have access, plus 200 million don't have access to it. By the end of the decade, we will add another 100 million women in reproductive age. So it's a burning topic. We all know that family planning is a key enabler for women to thrive, to really get to their full potential. So we're halfway through. Yeah, we've heard various calls to action during UNGA and other meetings, and we really have to speed up and double down. We're halfway through with our 100 million challenge, but I can tell you the second half will be even more challenging. Yeah, so it's the second half which really needs us, and which we want to address. And there's many things that we do together with our partners, with UNFPA, with USAID, to name a few supranational ones, but also with local partners, NGOs, with our colleagues on the ground. And in an increasingly tech-savvy world, of course, we see that it's not just about partnerships, it's not just about analog ways of offering family planning services. it's also about reaching more women by digital means. So, and there is a couple of examples I want to share here with you where we have started the journey to expand the outreach with digital solutions. So you may have heard about the Your Life campaign. The Your Life campaign is actually culminating every year in the World Contraception Day, which happened just a month ago, a week ago, in the September 26th. It's really orchestrated by Bayer with many multilateral stakeholders and really reaches a lot of people. By the way, the yourlife.com website is the most frequented one in the whole Bayer corporation. Yeah? So it shows that there is a strong outreach. We are reaching nearly 200 million women with this campaign every year. So that's one example. Another example is called Your Life Yangu, that we have built up with the German Foundation of World Population, Deutsche Stiftung Weltbevölkerung, where again we are bringing sexual and reproductive health services to women, in this case in Kenya, for them to help make informed choices on if, when, and with whom to have a child. These are just a few examples on what we're doing. We have a few more to share, perhaps later in the discussion, with UNFPA, with Zuri Health. I think also for me personally, it's an exciting journey, because I can tell you a couple of years ago, I have not been as digital savvy as I probably have been today. I mean, the big question is really, how do we manage not just to reach women and girls with our digital services, but how do we then help them to get to the healthcare infrastructure that provides them with the choices they want to sign up for? And with this, I hand over back to you, Ariane.
Thank you so much, Klaus. Ike.
Thank you very much, and good morning, everyone. My name is Ikechukwu Arthur-Anoke. I'm CEO at Zuri Health. Zuri Health is Africa's leading health tech company, providing accessible and affordable healthcare on demand. There is a growing consensus today that home is the new hospital. We agree. At Zuri Health, we will add that mobile is the missing piece. Why? The mobile penetration rate on the continent is close to 50%. In some countries in Kenya, 109%. It could be argued that every household has a mobile phone. Our mission at Zuri Health is to be able to make this statement boldly in a few years, that every household has a mobile hospital. I am proud to announce that Zuri Health, in partnership with Bayer, is working together to provide access to contraceptives and continuity of care to women and girls. And there's no better way to tell the story than to tell you the story of Njeri. So Njeri is 17 years old. Njeri lives in the outskirts of Nyeri. But Njeri has questions about sexual reproductive health that Njeri can't walk into the nearest healthcare center to ask, because of norms and social constructs that could mean her getting into trouble on how to deliver contraceptives to her safely. But it's also important to mention that Njeri could also have issues. My body is changing. I'm beginning to use these contraceptives. What is happening? Usually, the instinct is to stop and not speak and not get clarification, or to go online and search for information, but does not have the skills to be able to sieve the information. We're trying to fix that by providing continuity of care to ensure that Njeri will be able to get the information she needs from a professional she needs, who speaks the same language as her and who can communicate the benefits to her. That is empowering Njeri. But I want to tell you about Naisula. In one of our health camps that we did in Narok County, Naisula is 30-something, and Naisula came with her husband to our family planning tent and said that the husband said, I want her contraceptive out. And that is the reality a lot of women face. But by building strong partnerships building partnerships with pillars of trust. Our partnership with the Nara government, we're able to engage Naisula and her husband and find out what the issue is and be able to, in one way, explain to Naisula's husband that this is wrong and you don't have any right to tell Naisula what to do with her body, but also, importantly, to educate them, because one of the biggest barriers for healthcare, accessible healthcare, and when we talk about sexual reproductive health, is education and information. Ability to educate and inform. And that is the story of Naisula. So for us at Zuri Health, healthcare is extremely important. Very important. But more important is female healthcare. Because research shows that when you educate a woman, the household grows significantly. You pull more people out of poverty. Imagine them having control, full control and empowerment in issues that deal with their sexual reproductive health. Imagine them having information, detailed information about what to do, where to go, to get safe contraceptives, and this is our essence at Zuri Health. Thank you.
Thank you so much. Javier.
Yeah, everything is said. No. Good morning. I'm Javier Gonzalez. I work for the German Red Cross in Colombia and Venezuela. And our main task is to provide technical support to the national societies of the Red Cross in the field. I have been working for the Red Cross some years, but I was talking to you, we never stop learning about some issues. And despite we work as a Red Cross, we are quite well known in providing emergency response services and healthcare in emergencies. We have learned a lot about family planning within the last year. We have a project in the Colombia and Venezuela border that aims to provide healthcare services, but sexual and reproductive services, but family planning services. And the aim is it is to avoid the interruption of family planning during emergency response. And maybe it is easy here to say why, but it's not as easy to keep that services running in that kind of contexts. Emergency response is quite complex, and we are talking about emergency response during the big disasters, or during an armed conflicts, during our migration crisis that are affecting our territories. And it's not easy, and somehow has been forgotten during the traditional response of some humanitarian organizations, even in the Red Cross. So our project, it was called a pilot project, but it's more beyond a pilot project. It is to provide guiding documents to help our Red Cross workers and volunteers, but also to train healthcare workers of the public systems to help them to include family planning in their current activities, not only in emergency response, but during the healthcare services. Also to provide family planning methods for women, but I think the most important, and has to be with digital, is to increase the awareness about family planning importance with young population through the use of mass media, social networks, because it is quite easy and cheap. But we cannot forget that in our context, some people, they don't even have electricity. We were talking about, because for you there was a big crisis this morning because the lack of electricity in your house. But this is the daily life of millions of people. And we were in that context. And we need to be aware of this. And we need to cope with this reality. Digital is quite okay. Digital is unstoppable. but we need to be aware of the reality of many people. And when it comes to health, there is still big barriers about to have access to health care. In this project, we have been receiving people, women that travel from Venezuela to Colombia to reach the Colombian border, hundreds of kilometers, sometimes by car, by walking, just to receive family planning services. Because in their country, it's not easy to access, not only because it's not available, but because it's very expensive. So it is a matter of health, it's a matter of rights, it is a matter of protection, it's a matter of life. It's a quality of life for women and girls, and we do it thanks to the partnerships and the cooperation we have with the Venezuelan Red Cross. Here is my colleague from Venezuela, with Colombian Red Cross, and with support of Vaya.
Thank you, Javier. Thank you. Yes, the story he referred to is that I had no electricity in my house this morning and had to get ready in the dark with 2 kids and a dog freaking out. But that is not comparable to the things that Javier has seen. Nomi, I'll hand over to you.
Thank you, Ariane. And just go off script here for a moment and just say we are all watching the news and seeing conflict, particularly in the Middle East, but everywhere, climate crisis. And it is so important to have partners like you, Javier, and the ability to respond fast with a gender lens, including maternal health, reproductive health, family planning. We all need to be agile, and really grateful for the ability for humanitarian organizations to keep women's health needs front and center. So thank you for your work. Yeah. So good morning, sorry, I'm completely off script here, but it's emotionally hard to pretend that the world is not happening, right? Like, it's not authentic, it's not honest, and so as we sit here and we talk, we need to acknowledge everything that's happening around us. So I'm grateful for safe spaces to be able to talk about that, even as we're online, and with those of you in the room. So I'm Nomi Fuchs Montgomery. I'm a deputy director in the family planning team at the Bill and Melinda Gates Foundation. Thank you for inviting us. It's a pleasure to be here. So the Gates Family Planning Strategy is centered on meeting women and girls' contraceptives needs, preferences, and importantly, aspirations for their future. And as part of the strategy, and I'm not going to go into the details of all of our work, but I really want to hone in on innovation, like my colleague here from UNFPA, to talk a little bit more and double click on some of this work on innovation. So we're looking, as many have said, all of you have said, on empowering women and girls to access family planning, counseling, information, products, and services to advance their health and wellness needs. And Klaus, I think you mentioned this, when, where, and how they want. And I think that's something that we all share, right? That this is not about dictating which channel, but it's really empowering choices and enabling those choices. Our work focuses on scaling family planning high-impact practices, and we're a proud co-sponsor of the high-impact practices, along with WHO, UNFPA, IPPF, FP 2030, and USAID. And those high-impact practices, if you haven't had a chance, please check out the website, include both kind of supply side and demand side. And one of the high-impact practices is mass media, as I'm sure everybody in the room knows, really to expand access to sexual and reproductive health information. And leveraging digital channels is just one aspect of that work in supporting a women's reproductive health journey. And this is something that my colleague from Zuri Health talked about. Like, it's not a one-time situation. This is about a continuation of care. But I want to pause here, and I'll talk about this throughout the conversation today, that we want to acknowledge that there is still quite a significant gender gap in who has access to digital platforms. And we all, I'm sure, agree on this, and we've touched on this. Among the millions who do have digital access, and Ariane, you mentioned this, we see that digital platforms can really be an exciting, scalable channel for high quality, personalized, and private and confidential and convenient care. And I think you're an exemplar of that, frankly. And we're supporting grantees in this work. And many of us had mentioned concrete examples, but I think it is helpful to kind of like take this from the theoretical to the specific. So one of the areas that we're doing that is in direct-to-consumer and e-pharmacy and digital counseling channels, and bringing high-quality, consistent, and convenient care right to somebody's home. And frankly, I would want this, right? Like, I think this is something that if you have the ability, it is really a phenomenal way to overcome barriers, especially distance, time, and all of us struggle with that no matter where you live, and some people it is really exasperated. So just to mention a specific example here, in Nigeria, we're funding DKT, who's established a multi-channel platform called Honey and Bananas. They have a website, so again, please check that out. And and it's such a great name, honestly. So Honey and Bananas connects people to find information on how to purchase family planning options online, book an appointment at their local health clinic, chat or call a counselor, and get referral services. So that is that interaction between digital and counseling. We're also committed to increasing access through channels that are closest to women and girls, such as community health workers. And again, just I'm kind of summing up what's happened in the last couple of days, but I have been so pleased to hear the conversation around community health workers, particularly the majority of whom are women, social protections, and the importance of pay. And so as we think about this, all of us, as we're integrating these channels, need to keep those priorities front and center in mind. So working through community health workers, connecting to pharmacies and drug shops, and just an example of this, we're testing models that introduce family planning counseling and products, including expanding choices, such as the availability of plans through both e-pharmacy and then brick and mortar, so kind of connecting that divide. I'll talk just 1 second about gender equality, and this is really a foundational aspect of our work. At the Bill and Melinda Gates Foundation, we actually assess every investment that we make, whether it's gender neutral, gender intentional, or gender transformative. And as an approver of an investment, it's my responsibility to look through that assessment rating and really make sure quality assurance. And if the investment is not moving in the direction towards gender transformation, we can actually provide additional funding to support capacity building to move in that direction. We did talk about the amount of access around digital, but I just want to quote something from UNICEF that says that 9 out of 10 young women and teenage girls in the poorest countries actually have no access to the internet. And I know we'll talk about this further, but it's really important that we focus on dismantling the gender-digital divide and underlying gender norms if we want innovations to benefit women and girls. 2 quick points, and I know we're quite at time. We talked about AI. All of us in the room know that in November, when GPT-3 was launched, November 2022, the world has changed, right? Like the possibility of AIs really has changed what we're doing, and we're working to be agile and pivot our partners to include this new technology in their research plans. So we're doing this in Kenya and Senegal. But I want to take a beat here and say, very explicitly, when we think about ChatGPT and what's happening now, we need to think very carefully about the ethics, safety, and accuracy of AI. And we're encouraging partners to do this. If we do not pay attention to this, AI is going to continue to exacerbate harmful norms, and we are going to have a ripple effect in the future, whether it's racism, misogyny, misinformation that can happen. So it's our responsibility to leverage this platform, but also to really think about how do we change the platform to ensure that the new technologies are supporting a more just and equitable world, rather than deepening the divide between high and low income countries. So last point here, there is no silver bullet, and we all have discussed this, that we want to make sure that we're not being irresponsible and getting swept up in the sea of possibilities of what AI can do without thinking about people who do not have access to digital or frankly do not choose to use digitally enabled platforms. So we're looking at ways to, again, think about that human-to-human interaction and leveraging it, as you said, as an enabler. Thank you.
Thank you so much. That's been an absolutely amazing start. And I would like to just reach out to the audience here and say I am definitely going to allow for a substantial Q&A session. So if you have any questions, there will be a chance in a few minutes to ask your questions. I was going to ask you all about challenges when it comes to digital and AI, but I think we've touched upon quite a few of those. Is there anything else when it comes to challenges that has not been yet discussed in this group that we should mention? Nagina, go ahead.
I would like to mention a few more, actually. So one, let's talk about financing aspect of it, and not only financing, of course, from the user perspective, and this is what Naomi mentioned, not everyone has access. If there is one phone in the family, the girl will be the last in line to use it. If there is any purchasing power to buy data, that girl or woman will be the last in the line to use it in many, many communities. So that's one aspect, but also to have more innovation and technology, it has to be invested in. And if we're talking about family planning and women-centric solutions, we know that it's about, even in most developed countries, it's only about 4% of VCs who invest in women-centric digital technology companies. So that's something which needs to be changed. And that's why we know that even globally in health, it's just 1% beyond oncology, which goes from 2.4 trillion US dollars, only 1% goes to women-centric solutions in R&D overall beyond cancers. And if we talk about digital technology, that's like much, much less. So if we don't bring that into the attention, that it's not going to be as rapidly developing as in many other worlds. And another is the inclusivity in data set. We talk about gender, and we know we talk about AI. Over 80% of AI solutions produce errorless outcomes because they are biased. The data set is biased. And we know so much AI is now using in healthcare too. The same problem. Historically, AI data sets so biased, women are not included sufficiently, and we can't expect AI is intelligence, but it's artificial intelligence. There is still human behind it who puts and creates the data set and train the AI. So we are, as humans, and those who develop it, should be consciously addressing that. How do we make sure that it's gender equitable and produce equitable outcomes? Another challenge is related to the ethical applications and principles. AI and other digital technologies can actually exacerbate such things like tech-facilitated gender-based violence. Yeah. Data, if it's not secured and protected, if your image online cannot be protected, if you don't have rights over it, as we call body right, if you place something online, music piece or movie piece, and you don't quote the author of it, it's taken away. But if somebody uses my images distorted, use it as misinformation, I have no rights, I have no way to even apply an appeal and say, okay, remove it because I didn't consent to that. So, and women, unfortunately, are more subjected to that, and girls, and now they are so much online for education and healthcare and information, but data safety and security is not always addressed, and that's why sometimes it actually brings more problem than help. And it's not unsolvable, it's totally solvable. If the people, developers, engineers, and those who are in charge of ethics of that, consciously addressing it from the very beginning, not as a damage control afterwards, but from the design stage of that, applying human rights, applying ethical norms and principles, that can be solved. So these are just few which I also wanted to mention in addition to what was already mentioned.
Thank you. Anything else? Yeah.
Yes. Thank you very much. And Nagina started with a very burning whatever, which is funding. I like to look at it from the opportunities of startups and people who are innovating around healthcare need funding. There's a lot of investment has gone into fintechs, and health tech has lagged behind in terms of funding. It's very important. So I would appeal to VCs, corporates, stop giving politicians money, bring it to us creators that we're creating around healthcare so that we can build important solutions that will help equitable, accessible healthcare. And there's another important question you mentioned, which is one of the challenges, and it's about regulation. Now, when you look in Africa, for example, the challenges are either over-regulation or under-regulation, and it is very difficult to innovate in a place where there is absence of regulation. So it's important that as we keep innovating, that we're working together to ensure that we put the regulation in place to support and strengthen, because one of the good things that regulation does is that it helps build those trust pillars that is needed for the adoption of healthcare. Now, Nomi, you mentioned something very important in terms of access, and says from a digital perspective that 9 out of 10 people don't have access to the internet. I agree with you, and that is why at Zurich Health we do not just do data, we do what we call inclusive tech. Because people without access to the internet, which is 65% of mobile phone users on the continent, with basic SMS can get first-level medical consultation and engagement on issues of sexual reproductive health and any health tech issue as well, and also access to where to go to get fitted and pointed. So we building with that in mind becomes very important, because when you're innovating with understanding of the local context and the challenges, it helps increase inclusivity, and that is very, very important.
Javier, where do you see the greatest need or potential for AI and digital to be enhanced in humanitarian settings?
Yeah, but first I would add some the challenges, and something that really worries me is the increasing of humanitarian needs and the decreasing of humanitarian funding. And because more and more we are focusing on the big situations, but we have still a lot of forgotten crises, really silent crises. When I come to Europe, I am totally shocked about how forgotten is Latin America. Latin America is not in the media in Europe. And we in America, in Latin America, we have still ongoing crisis. We have a huge migratory crisis in Latin America, and it's totally forgotten. You have here in Europe your own crisis. But please don't forget the small ones, because the small ones are as extreme as the big ones. And in terms of challenges, we have physical challenges in terms of access, but we still have to deal with some other challenges like taboos, social challenges. Talking about family planning is not still easy in some contexts. There is a lot of stigma and discrimination about family planning. And it's, for me, the most worrying, because as I told you this morning, I have learned a lot of family planning. Family planning was not in my head some years ago, months ago, but it's totally unbalanced, gender unbalanced. We still talk about girls and women, but men are really important in some relations of power about family planning, so don't forget that. Room for improvement, a lot. Yeah. Yeah, we cannot forget digital. We cannot fight against digital and intelligence, artificial intelligence. And for sure, it will help a lot for healthcare providers, humanitarian workers. It is quite an amazing tool, but we have to keep it simple. We have to keep it accessible for people that are not really maybe well trained or aware of the use of new technologies. Sometimes I feel that I'm behind of the use of new apps every day. You can find a new app to do whatever thing. But also, we need to keep it affordable. Because I'm afraid that as much as sophisticated is less affordable for most of the people.
Partnerships are so important here. So we all see everybody brings a specialty to the table, but Klaus, I want to turn to you and discuss the importance of partnerships, because Bayer signed 2 new digital partnerships this year, and also yesterday the big announcement with UNFPA. So perhaps you can explain a little bit why the partnerships are so essential when it comes to reaching those girls and women.
Before I answer your question, let me just also state that I think the biggest issue is to really understand what the individual goes through, yeah, and to follow that through. And that's why we need some partnerships. In the digital space, for us as a company, it's also important to have partnerships that do not do any compromise on quality of information or recommendation. So as a pharmaceutical company, you're used to very strict regulation, you have quality assurance, you have tight quality windows that you have to meet, and the same applies to digital solutions. And that's one of the lenses through which we choose partnerships. And I think that's something we shouldn't forget, because the outreach is big, and that's the second point. The outreach with digital solutions can be massive, but then the second question is, how do we get the individual, which has been informed or reached, into the hands of a proper healthcare service provider? And I think that's also something we need to figure out. We're not in a position as a pharmaceutical company to really be the partner along the entire journey of a woman or a girl, and that's why we invest in partnerships. You mentioned the partnerships with UNFPA on the Equity Alliance, which is a great initiative, which also will help us as a company improve when it comes to some of the indicators for proper equity within our company too. But the second part is also partnerships in the area of family planning, of course, with UNFPA. We've been a supplier since the 60s, and we've grown, both organizations, I think, have grown in this partnership and really have reached tremendous successes and milestones along the way, but we can't rest. The digital activity in India that we have signed up for can also be seen in the broader context of an MOU that we have signed with UNFPA headquarters last year. And we intend to reach 6 million women by 2027, mostly in rural areas. The service is an AI-enabled platform and a chatbot that helps provide sexual and reproductive health services information, family planning information to those in need, and has a component of system strengthening. So we hope that there will be the connect between the digital outreach and the physical help and the healthcare worker interaction with the family or the woman or the girl. So I think that's a great example of a truly impactful partnership in the years to come. We do have 350 million women in reproductive age in India. 49 million of them have no access to modern contraception. 49 million. There's a couple of European countries who are that size in terms of population. So 49 million women don't get the service they need. And coming back to SDG 5 and its key role in achieving so many other SDGs, I think that really is a call to action for us. The second partnership, and I'm glad I'm here with Ike from Zuri Health, is our partnership in Kenya. And that's special because, as you can imagine, large corporations have, let's say, a core area of expertise where they really can bring innovation to the table, but we also need those innovative, fast-moving startups, growing companies that know the customers and that have established networks. And we have an investment arm which is called Grant for Apps, which is screening for promising startups and successful startups. So we help them with seed funding to really set up specific programs. And that's how we came together with Zuri Health. And again, we have this great opportunity with you here to connect the information and education services with giving direction as to where the woman or girl can go. She knows which pharmacies she can go to, which healthcare provider she can go to. She gets that orientation, which is super crucial. Imagine you're living in a remote area, you get the information about family planning and you just don't know where to go. It may be like 5 valleys away and it's like a 2-day travel and you're stuck. So, and that's what we actually try to solve for. And lastly, we also have to understand that in this journey that a girl or a woman has, in countries like Kenya, oftentimes women don't have a bank account or a credit card. So how do you pay for the services you're asking for? So you don't have any means to purchase the product or the services that you would like to have. And that's why we also work with financial service providers that help us, for example, setting up digital wallets so that they can accumulate savings, and then for the first time, they can participate. So they can be part of the healthcare system, and the providers that are connected to the service are there to help them. So there is a lot of details that you need to keep in mind along the way. So when we think about our 100 million challenge, it's a big number, but it's 100 million defining moments for women.
Thank you. Ike, since we're talking about Zuri Health, it's an example of a digital platform it's really changing the space of what healthcare means, specifically in sub-Saharan Africa. Why do you think now is the time to grow and expand with this?
Yeah, thank you very much. I think it's important. Healthcare is a fundamental human right. Everybody needs, deserves, and should have access to accessible, affordable healthcare. It's also very important today because with emerging technologies, both new shiny new techs like AI and inclusive tech like existing, that it is an enabler and can help ensure better access, remove barriers like affordability, and ensure that people have access. We can't keep access to accessible, equitable healthcare. So it is the best time was yesterday. The other best time is now. We need to grow out health tech because a stronger collaborative approach from innovators, funders, the NGO, farmer, and government can help provide the strong leadership that is needed to address issues around healthcare, because there are a lot of them. So now, and we are moving ahead, and we are asking everyone to join us as we, move towards this very important goal of, accessible healthcare.
When you look at building up these kind of digital partnerships, what is it exactly that you're looking for? What are your primary goals, or what does success look like to you?
Yeah, it's a great question, and just thank you for bringing us all together. I think it's a really important conversation. And Klaus, you talked about like the what of partnerships. Maybe I'll just take a beat and talk about the how of partnerships, and this might be maybe a helpful follow-on. So there are a couple things that I want to mention just from a funder's perspective. There is, I love what you said, like the time is yesterday, right? Like there's, so a principle I would say first, and then the how, is that, and this is just speaking personally, like partnerships are key to everything we do. Like I think that the era of like going alone is just, it's just not possible, right? And so the ability to think about collaboration, coordination, bringing in, bringing in sort of all sorts of expertise is just so important for anything we do. So just to say, like, the value of collaboration and coordination, I don't want to leave that aside. But when we think about how we work, one of the most important things, and I wrote this down first, so this is actually my talking points, but I would say is engaging local partners. So I think that we, and the second thing I was going to say is actually the how around users themselves. So local partners who have the context and being expansive, both about the software, but also the hardware. And I think that this is a really important aspect, like that who are the people that are doing the coding, that are like creating the hardware, like are those local partners? There's so much local talent. Are those women and, women and girls, are they part of those solutions on all sides of the value chain? So it's both looking at local partners and the context, being expansive about thinking about, as I said, software and hardware, taking a gender lens, which I mentioned previously. That's something that we do with every single investment, as I talked about, and operating in partnerships, including with government, and especially working towards policy reforms. It's like we talked before we were on this panel, because this regulatory environment, which you talked about, that if we're only funding like the shiny bullet and we're not thinking about regulatory and policy, we're actually going to, frankly, miss the boat. So I'm so glad that you raised it. And I think these can take so many different approaches, and maybe, do I have a second for a concrete example?
Absolutely.
Okay, so one of the examples that I wanted to talk about here in terms of these types of partnerships, and to kind of bring in both like working with governments, is work that we did. Actually started this in 2016. We co-financed a partnership in Ethiopia with, we were working with the Children's Investment Fund Foundation at the time, still are, on a project called A360. And I'll get to the digital in a moment, but just to say, what was really exciting about this was we were taking a human-centered design approach. And when you go up for an investment and you say, okay, what are the results? And Klaus, you talked about this, like, here's like, we want to achieve X, Y, and Z. And we were taking a huge risk to say, we have no idea. We want to reach, and in this case in Ethiopia, it was young, married, rural girls. Very hard to reach. Like, and these are often girls who, victims of gender-based violence or child marriage. And we said, we're not going to sit here, and in this case for me, in Seattle, and say, I know what the solution is. So we took this massive risk and said, the girls themselves are going to design the solution. So this was 2016. We went through a really phenomenal process, co-financed with SIF, with PSI in the lead of this, I would say, partnership here, and it's evolved over time. And so the young girls themselves came up with this idea of Smart Start that really looked, it was like a baby calculator to help like inform decisions on, if, when, and how many children to have. You talked about male involvement, like how to get male partners involved, religious leaders. So what's happened now is that in our relationship with the Ministry of Health in Ethiopia, and through this Adolescence 360 project called Smart, the program has evolved. The Ministry of Health, and Dr. Leah was speaking yesterday at the Global Finance Facility event, and who's just a phenomenal leader here, and to just say that the Ministry of Health has expressed their interest in kind of further institutionalizing this through their digital integration community health program. So it's kind of like what we were talking about, is that it's like how things evolve over time. You might take a risk in some place, and then it evolves eventually into a digital platform that's government-owned through sustainability. The same types of partnerships can happen with private sector as well. So just maybe to end it there, that these things, yes, we need it yesterday. We need the regulatory environment. We need the government to come in, and we need to be adaptive in both public and private sector. And absolutely, we have to have girls at the center of the design.
And working together, right? Yeah, that's the only way. Talking about partnerships here, Nagina, you're pulling together many partners through this Equity 2030 Alliance. Can you highlight where some of those key strengths lie when you choose the partners, especially when it comes to digital in this specific field? What is it that you're looking for?
Thank you, and it's very excited and proud. We launched that alliance. We had the soft launch during UN General Assembly in New York, and the global launch just yesterday here. And I think the idea came out of really necessity. We know there are gender gaps in solutions, starting from design. We know women are not necessarily included in the data sets, and there are very few investments going to women-centric solutions. And the results are really coming from inconvenient to actually like fatal, lethal, like we see in the car crash, for example, industry. The car safety was not designed on a female car crash dummy until last year, and the first average car crash dummy was just invented and released to the market last November. and how long we drive the cars. And women are 3 times more likely to be injured in a car collision because of that. We know because women are not included in clinical trials sufficiently. Only 22% of clinical trials in early stage have women's representation. There is really high adverse reaction to medicines when they take it because medicines are not designed for them. There are not enough new treatments and diagnostics on the market for women. And still it all comes to that very lack of investment. And we said, okay, we can't resolve it just by ourselves. We have a convening power. We are in 150 countries and territories, but we don't produce services or products. So we can't shift that needle and can't really disrupt the status quo by just our own efforts. But we can do it through others and through the action of others. And this is how the idea of Equity 2030 Alliance came to life. We said, okay, let's do it through the members of the Alliance. But we said we will not make it easy for the members. It's not enough to say we support the idea, great. We say, what actions can you demonstrate? What are you doing as a company or as a member state or as academia to really change it? And at first, before we came out with the launch, we really handpicked the companies, I must admit. It wasn't an open application. And we went to those who we knew already doing something in that space. And Bayer came one of the first responders, so to say, saying, yes, we have some great examples how we drive the investments towards women-centric solutions. And some might argue, yeah, but it's the business model, a part of the business model. And we say yay to that. Let's have more companies who would have, as part of their core business model, women-centric solutions, investment into that, new technologies. And technology is not only digital. Technology is basically any science, any diagnostic, any new invention is technology. So how can we make more companies putting more resources into that? We want to normalize this conversation. We know that gender equality in the workforce, for example, is becoming more and more normal. Yes, we're not there yet, but if today this panel would be all men, everybody would say something is wrong with that. So we did normalize that conversation. But equity in design and in resources is not yet normalized. And this is what our goal is, that in few years, by the actions and actually leading by examples, other companies, other entities, including academia, who are a really big part of research, and also curricula, because it's not even part of the curricula. If you're not trained to be gender equitable, as an engineer, as a doctor, as a future researcher, you will not be practicing that. Someone needs to bring it to your attention. It doesn't come naturally. So this is the whole idea of the Alliance, how we can bring technology company, biopharmas, researchers, academia, NGOs as a passions advocates, basically. Of course, civil society is the biggest voice and driver of the change. And the member states. And Germany became first member, actually, as a member state of the Alliance, and we have champions from Norway and Ghana, hopefully to have more. And from now on, we will really open it to everybody and say, okay, look at the examples, look what others are doing. You can do that too. You can be part of that good class, as we call, and really lead others by this example. We have digital companies too, for example, HP joined, we have Salesforce joined, and we have a few other big names from the top tech companies who are in the process of applying. And really that's the whole goal, how it's not us, UNFPA, UN doing it, but we have the power to bring others under that umbrella and through their action to actually change and challenge. So thank you again for this conversation, because I think what is really also important that we're all coming from different angles, and really thank you for Red Cross of bringing the people on the move, people who are displaced. We all aware that this is a very different reality. It doesn't mean that other realities shouldn't need to be attended, but it's all should come in one picture, and we should think about it inclusively, and as we call, building that inclusivity muscle. So when you think about any aspect, you think about all the different groups of population, not only most privileged or most stable one, because there are millions and millions of those who are in a very different situation. And your perspective, and your perspective, and your perspective, the developer, of course, and as a founders, that only through that different angles we can come to something which is actually impactful and sustainable and truly inclusive from all angles. Thank you.
Yeah, thank you, Nagina. It's so true. It's not just different angles from the world of digital. It's everybody from a different corner of the planet, which is so amazing. I have a range more of questions, and I could sit up here and continue this discussion for hours. I have so much to ask, but I do very much want to open up the floor to the audience. So we do have a young woman with a microphone. So she will hand it over to you. Perhaps we'll start with the gentleman in the aisle there. He was very quick to raise his hand.
My name is Mustafa. I'm a junior doctor from Kurdistan, Iraq, and I also work as a digital marketing in health field as well. First of all, thank you very much for attending here and for your fruitful discussions and for your impressive efforts as well. So I wanted to ask a question regarding some of the vulnerable groups, such as the refugees. As we know that there are more than 100 million refugees by the end of the 2022, and almost half of them are women, according to the UN Women. So how can we target these vulnerable groups, including the women? And I'm not only talking about the refugees that are present in Europe, let's say, but there are many more who are in the other low and middle income countries. For example, the Kurdistan region of Iraq hosted thousands and thousands of IDPs and refugees during the ISIS war, and many of them are still remaining in the camps. There are little access to healthcare, let alone to family planning services and digital technologies. So how can we be able to work with the governments or with the other local organizations to be able to provide these cares and these services to them? Thank you.
Thank you. It's an excellent question.
So thank you very much. I think this is where the strength of collaborativeness works, because listening to the picture you've painted, some of the technologies that we have could work. Being able to have remote care in those areas, access to, low inclusive tech, basic SMSs, chatbots could provide access to accessible healthcare information for people there, and also be able to plan with them on where to get, if we're talking about contraceptives, access to nearest areas of contraceptives, etc. So we're ready, available to support if, we can go with anyone to say, how can we do this? Because essentially, if we're building from, low income middle country where our reality, that is our reality every day, then it means that we have some competencies in being able to provide similar technology in those regions. So happy to help, happy to engage after this.
Thank you. Go ahead.
Just to add, so very specifically, the area of humanitarian aid is one of our core areas to really achieve our goal of reaching 100 million women, and we have a lot of partnerships with the Red Cross, for example, where we provide logistics and logistical help in reaching those who may end up in refugee camps. So that's one a very strong focus area of ours in the work we do for women. Secondly, of course, migration may have different reasons, civil wars, be it climate change. Another very distinct activity we have is in partnership with the Johns Hopkins University, where we have helped to co-fund and bring en route the so-called Challenge Initiative, where we offer, or the Challenge Initiative offers family planning services in the mushrooming megacities in Asia Pacific, in Africa, for example, where oftentimes migrants come to these really fast-growing cities, and where they often meet poor healthcare system conditions or little services, and that's where we want to help by offering family planning services. That's probably a second example of how we want to direct the support to women in need.
I want to give example exactly what we're doing in Kurdistan with the technologies for those women, because also we know that the difficult economic situation, poverty, displacement also leads to, unfortunately, more gender-based violence, domestic violence. And one of the female innovators we supported through our accelerator fund, Equalizer, is SafeU. And it's a platform which works also offline and it connects you to the safety net around you, including your friends and families, but also shelters, women's centers, police forces, if it's enforced there, operating within, kind of mapping the safety net around you within the existing. And we worked with the government of Kurdistan and Iraq to actually introduce it and map it. And we also enabled many women through the access to the digital tablets and platforms, and even very simple phones, because it can work offline. Once you download it and subscribe to that, basically register yourself, you don't have internet all the time to have access. And that's becoming quite popular from what I know, and that's also because it's done with the civil societies, with those who work on women's safety, and with the enforcement police forces too. So really trying to integrate it and train responders how to respond it, through the survivor center solution, really addressing her needs and putting her in the center. So that's just one of the example what we're doing there, addressing the needs of women through their safety too.
We'll turn to another question. Perhaps the woman close to you there. Yes.
Oh, okay. All right, so my name is Marian, and I'm currently doing my second year in my Master's in Public Health, originally from Cameroon. And I'm just trying to ask a question concerning this. So I've had the privilege of working both at the community level and the clinical level, and I'm just curious about the involvement of some other influencers like the mother-in-laws, the mothers, and educational institutions in all of this. Because we may teach the women and they go back home and learn something different. And take it from me, all the women always say, my mother-in-law is not in for this, my mom is, especially people from Asia must agree with me, and sub-Saharan Africa as well. The mother-in-laws actually have like a very big say in how they handle the family planning. 9 months into a wedding, we start looking at your stomach and expecting you to already have a child or something like that. And this pressure comes from the factors around. So basically, I'm just trying to find out, do we have factors in place or something in place in order to bring these different influencers into the game? Because if we want to have a real impact, we actually need to include them. Thank you.
Thank you so much.
And I agree with you 100%, because we can talk about digital technology, we can talk about without healthcare education and information, then the adoption will be very low. I think that what you've described is the reality most women in sub-Saharan Africa face, and that is why it's important. And when we say that we need to build these solutions around women, it becomes very important so that even the mother-in-law and has information, the right tools to help retrain or re-advise, or whatever it is that she does to in health. So I think it's very important, because it's not just that, it's also the community health workers, because they become very important. In fact, in last 2 weeks in Kenya, 100,000 community health workers were empowered by the government, and majority of them women, to be able to take healthcare into every home. Now, it provides comfort, and it's very important. So building the solutions around women in our reality would help very well to answer part of the questions you've raised. So yes, education, influencing, healthcare influencers. We have a healthcare influencer from Zuri Health here. Part of the thing is storytelling, being able to use, to express or educate people in simple, understandable terms. And we had a Proko doctor in Nigeria do it every time on Twitter and do it very well, and gain massive following as a result of what he's done. So these are part of the things that we're doing. So you can't have digital health, inclusive health, without the fundamental, which is education and healthcare education. So I agree with you.
We run husband schools, other influencers. So it's schools for husbands in few countries where we bring husbands and trying to convert them to be more responsive and understanding of the gender equality, gender equity, and women's needs. Maybe we should run mother-in-law schools too.
Let's turn to the next question, please. Take someone here at the front.
Thank you. Exactly. I want to build on that question a bit and want to have a bit more specific answer and challenge you also a bit. My name is Monika Cristofori Katka. I'm working for the Swiss Red Cross. And my question is really in the co-designing, which is so important. And you mentioned a couple of times, Nomi, that to have women in the co-design, but exactly that's also the question, where are the mother-in-laws? Are they involved in the co-design? Are the men involved in the co-design? Does the chat box talk to me as a man in male language so that I get interested to actually use the app? Or is it in the end really only so women focused? And I'm being a bit provocative. And I'm also asking Klaus, the digital wallet, great idea. I mean, we heard a lot of great ideas, but does it not exacerbate sexual and gender-based violence in a household, for example? Because a woman now is empowered to have her own money, but the social norms actually do not allow this. So, you know, I love this topic of family planning because it's so controversial and we have to be really very sensitive to do no harm while wanting to do good. Yes.
Very good point. Thank you. Who wants to start?
I can start.
How's that?
Maybe it's such a great question, and I think that also with the young woman from Cameroon, that this, when we talk about sort of being user-centered, right, like a lot of that is not, you know, if we were designing in Seattle, we might not think about mother-in-laws or influencers. We wouldn't know. So as a funder, you know, it's like removing the ego and saying, let's put the resources into the community and have the community orient and dictate how to engage. And so with the example I mentioned previously with A360 in Ethiopia, that religious leaders, men, community health workers were all part of that design process and were included in shaping the engagement. So of course, though, it has to be centered on the young woman that we want to reach, but we need to understand and have her kind of help connect and bring those voices in. Another just very quick specific example that I wanted to mention is a program in Indonesia called My Choice, and this is led by Johns Hopkins Center for Communications Program. And it was also designed as a client-focused, client-driven approach to assist Indonesia in addressing stagnating contraceptives, increasing unmet need, and skewed method mix. And this has been around for a while. And it was really looking at bridging the divide between in-person and digital services in different ways. And I do want to come to your question about, like, who are you reaching? And so one of the exciting ways that this rolled out, and there were many kind of like digital solutions, was through a tablet. It's like, it's digital, but quite low tech, that went through different contraceptive options, like the sort of benefits and side effects. And it also included stories from religious leaders, from community members. And this is, again, sort of like, how do you bring in those voices? And this was rolled out actually through an organization of community health workers who went door to door with this tablet. And these little videos were the people that you're talking about, whether it's religious leaders or mother-in-laws, like sort of explaining like their perspective around contraceptives. So I think it doesn't have to be overly complicated, but we do have to be very inclusive of a range of different voices. And I would say, particularly from the donor perspective, I think one of the most important things we could do is not pretend that we have the solution. Those solutions have to come from the communities. We have to resource the communities to elevate those voices and to bring those, like, diversity of voices into designing the solutions. And one point that I didn't say before, it maybe fits or doesn't here, but I didn't mention data, and I actually think it's relevant to your question around like controversy. I think it was Melinda years ago who said something about digital makes the invisible visible, and it doesn't sound sexy in terms of partnerships, but particularly given some of these issues that you're talking about, like who's being reached, who's being included, or some of the real intensive harms that can come from AI if we're not careful about exasperating biases. If we're not measuring this, if we're not looking at the data, we're not going to know what to change. So I do want to make sure that we include that piece around data and measurement as part of our conversation. Thank you.
Yeah, great.
May I
Yes.
add something? Yeah, this is the importance of talking about partnerships. We are not talking about donors. And partnerships it's something really meaningful because we have different strengths, so don't be afraid of working with humanitarians. And for humanitarians, we should not be afraid of working with the private sector because everyone has something to contribute if we have common goals. You have the means to research, to develop, to innovate. We have the means to reach people, to reach the right people, and to include the right people in their own solutions. As a Red Cross, as an example, we have a network of 191 national societies, so we are mostly around the world. We have a network of 16 million volunteers, most of them very young volunteers, very motivated, very able to work. So we need each other to reach these goals, but it is quite interesting. This is the real power of partnerships. It's not a discussion about just funding, it's how to get common goals in a...
And truly support those who need the help, yes.
May I add, Ariana, also that answering that question, we, as UNFPA at least, it never is that the solution is just dumped in the community or introduced in isolation. It's always part of a much bigger and complex intervention in that country or community where we work on like changing social norms, like intervening with the child marriages, with female genital mutilation, with low status of women, and we work with community leaders, we work with religious leaders, those who are shaping those norms, and if we change their mind and attitude, they help us to change the attitude in the communities. So it never works as a, you bring something and it's shiny and interesting and you think it works because it will not work, obviously. And that's why it's the complex approach, that's the only way, and it's part of all other programs which we do. And talking about inclusivity, of course we talk about half of the population, women and all their diversity, but there are other groups too. And for example, to the young lady from Cameroon, we work there, we support a female association, it's a female group of young women with disabilities, and they create solutions about menstrual health and access to menstrual information about menstruation and their fertility through the assistive technology which they develop. So they know what they need, they know what they work. So we help them with the capacity building and certain funding to really do it for their communities. And also in Cameroon, we work with organization WeTech, who is addressing needs of the people at risk or survivor of gender-based violence, and they're also going now to humanitarian, to crisis-affected areas too. So really, that's not that we develop something and bring there, we support community, and they work within the community needs, responding to what they think is working and needed. And I think that's responding to the inclusivity part of it and really bringing everybody to that from the beginning.
Thank you. I'm going to take one last question, just very, very briefly. The young woman in the aisle, the hand was very high.
Very short, so thank you for seeing my hand. So my name is Alexandra. I work at The Case for Her. We are a blended finance investment portfolio investing in women's health issues. And I want to bring up social media that I haven't really heard been touched upon. So big tech is systematically discriminating women's health companies by rejecting their ads. And I want to understand how you leverage social media, but also how you tackle and battle with big tech censoring critical access to critical information that all of the beneficiaries that you're talking about need in family planning.
It's a tough question, but I may try. Thank you, first of all, Case for Her, to becoming a member of the Equity Alliance too. Welcome. And really, that's a difficult question because we can advocate for change of the ethical standards, but unless the tech company, the producers or runners of those social media platforms willing to change, it's really difficult. But we're trying. So for example, we have this body right campaign, which I mentioned about your right over your image, and we involve few governments. E-commerce in Australia, for example, and European Union is also coming aboard, and there is a global online gender violence, including misinformation. Yes, But again, it's really, this is where with partnership, again, we're coming back to partnership, because you can address it from the public sector and legislation, but you really need to make those private sector companies who run the social media to be with you in that. And some of the smaller ones, we have examples, and some are doing better, but still some are either neutral or not acting as fast as we would hope for. And I think here, the voices of people, like social CSOs, associations of any person, basically, this is where the noise, the positive noise should come from, not only from like UN and others and governments, but people should stand for their rights and say, enough, we cannot operate in that, we cannot be subjected to this misinformation and violence, online harassment. And unfortunately, again, women and girls are more vulnerable to that. So really a call for action from me that yes, we are trying, but that takes all of us, individuals including, to really change it.
Thank you. So let's continue the discussion off stage in about 4 minutes. In these final minutes, I would like each of you to maybe leave the audience with one key takeaway when they walk out today that they should remember. You want to start, Nomi?
Sure, and just a shout out. Thank you for asking Alexandra hard and tough questions, and I'm going to weave that into this last statement, but just do not be afraid, all of us, to raise your voice. So my kind of takeaway, and I've been thinking about this a lot this week, is that I think the advancement of AI and ChatGPT is like climate change. It is happening now. It is a reality for all of us. And these are what I like to call known knowns. And they're having a major impact on our sector. And as innovations continue to unfold at a rapid pace, and it brings up these really important ethical questions, we need to proceed with a realistic lens on how to leverage technology in the current environment, but also similar to climate change, and we've been talking about this week, we have to do this in a way of imagining and pushing for a better and more just and equitable world. And this includes requiring a kind of gender transformative approach, asking those hard questions, pushing collectively for change. And this includes the pipeline of innovations from those who are programming all the way to policymakers that can address the question that you asked. So I want to just end by saying, when we think about this, these are known knowns that they are happening, but we also have to come back to the fundamental principles, particularly when we talk about sexual and reproductive health and rights, that these must be grounded in individual choice, free from bias and coercion, and that we must never forget the value and experience of human-to-human interaction. So digital, as you said, is an enhancement, it's an enabler, but we need to make sure that it's based on individual choice, freedom, free from coercion, and supporting by the collective partnership of all of us with each other. Thank you.
Thank you, Nomi. Javier.
Yes.
I think my main learning today is no one can do it alone, so we cannot work alone. And the only way to reach what we want to accomplish is to work in partnerships, to work as a partners, and to have equal relations to get common ideals.
Yeah, thank you, very true.
Well, mine is a bit dramatic. I would like to ask all, please stand up.
Okay.
Icebreaker.
Yes. Going together, and since I'm doing from Kenya, I'm going to teach you a Kenyan word. And I want us to all repeat it together. It says, a Kenyan word. Is on? A Kenyan word, and in the spirit of partnership, I would like us to repeat it together. I want us to say, Twende pamoja. So we can say, Twende pamoja. Twende pamoja. Twende pamoja. It means we go together. Thank you very much.
Absolutely wonderful. Thank you. We go together, Klaus.
Yeah, what can I say? So
Yes.
There is one quote of a German writer that I like. It's Kästner. He said, es gibt nichts Gutes außer man tut es, which means there is no good unless you do it. So, and I think we can do a lot of good with digital campaigning and family planning. provided that we embrace high standards and provided that we make sure that the infrastructure is there for women to switch from digital information to practical aid and support. And I think it can be a very powerful tool, a very scalable and powerful tool to help us reach SDG 5. So thank you.
Thank you, Klaus.
Thank you, and hard to be last always. I think, as you said, many of you, technological revolution is happening. It's here, it's shaping not only today, it's shaping our future. And if we want that future to benefit, and the benefits of the technological revolution benefit equitably all of the population, then we need to ensure it from the very beginning and already now that we together build equitable future for all. So my pledge would be equity by design, including in technology. Thank you.
Wonderful, thank you. On that note, I would like to thank you, the audience, those that dialed in today, and of course those of you who joined us here in the room. Thank you so much for the World Health Summit, wonderful organizers, and the tech team in the back. Thank you, everyone, and we'll continue the discussion off
Thank you.
stage. Thank you.